Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair and couple of blankets. We are going to focus on the stability of the complete back, and in this, we are going to do the downward facing bridge posture with the help of a chair. We shall begin with some preliminary postures for the core muscles. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back, that should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the trunk. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms. Especially when you close the eyes, you must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms. Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they're all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh, from left hand push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit upright on the chair. Turn to your right side, sit sideways. Hold the top of the chair, inhale, exhale. Turn the trunk, chest and navel up. Twisting postures help to relieve the back stiffness. They also help to rejuvenate the intestinal muscles and organs. Watch your breathing. As we inhale, the abdominal cavity should expand, and as we exhale, it should contract. Slowly come up. Change side. Hold the top of the chair, inhale, exhale, turn. Turn the neck also in the direction of the twist. And keep the trunk upright. Trunk should not lean to a side. Watch your breathing. As we inhale, abdominal cavity should smoothly, gently, all around expand. As we exhale, it should contract. Slowly come up. One more time. Sit to your right side. Hold the top of the chair, inhale, exhale, turn. With every inhalation, stretch the trunk up. With every exhalation, twist the trunk. Be aware of your posture, be aware of your breathing. Slowly come up. Change side. Hold the top of the chair. Inhale, exhale, turn. Feel the muscles of the back, the chest, and also the abdominal cavity. Slowly come up. Stand up. Keep the chair with its back towards you. Put a folded blanket on the lower rib of the chair. One more blanket is reserved for resting the elbows. We are going to do the downward facing bridge, which is a good posture to impart stability for the trunk muscles, especially the lower back. Lie on your chest, foot on the lower rib of the chair, and keep the other folded blanket near the head. We are going to do the downward facing bridge with the help of the chair. Rest the elbows on the blanket. Inhale, exhale. Rise the hips up, straighten the legs. Both legs straight. Legs, trunk, head parallel to the ground. As you exhale, contract the abdominal muscles. As you can see, the elbows and the foot, they support the complete body weight. So this is like a bridge. So the muscles of the back has to become active to hold the posture. Slowly descend. Watch your breathing. One more time. Rest the elbows on the blanket. Inhale, exhale, hips up. Legs straight. Do not hold the breath. Watch your breathing. Watch the posture. Watch the complete trunk muscles, especially the muscles of the lower back. Also watch the abdominal muscles. These postures are also good in improving the tone of the abdominal muscles. Slowly descend. The balancing postures can be made little more challenging by reducing one of the supports. In what you did, there were 4 supports, 2 elbows, 2 feet resting on the blankets and the chair respectively. And by reducing one of these, you can improve your stability better. Rest the elbows. Inhale, exhale, rise. Legs straight. Now rise your right leg slightly up and hold the posture stable. Right leg down, left leg up. Breathe well. Left leg down. Be stable. Slowly come down. So when you rise the leg, you should ensure that the plane of the trunk does not change. The pelvis should not tilt. So even when one of the support is removed, if you can hold the posture stable, lot of muscles gear up into action, thus improving the stability. One more time, rest the elbows on the mat. Inhale, exhale, both legs straight. As you exhale, contract the abdominal muscles. Now rise your right leg slightly up. You are balancing on 3 supports. Watch your back. Right leg down, left leg up. Watch the pressure variation on the elbows. But keep the trunk in balance. Left leg down. Be aware. Then slowly come down. Relax the arms. We can also do with one of the supports removed at the front. That is, instead of the 2 elbows, you can support on only one of the elbows. So keep the right elbow across, forearm parallel to the blanket. Initially you may press the left hand on the floor or keep it up on back and inhale, exhale, rise, legs straight. But ensure that the shoulder girdle do not tilt. You should hold it in balance. You are supporting on only one of the elbows. Slowly descend, then chain. Keep the left elbow across, right palm on the back, inhale, exhale, rise, legs straight. As you exhale, contract the abdominal muscles. Slowly descend. All these things help to improve the strength and stability of the trunk muscles. One more time. Right hand across, press the right elbow, left hand on your lower back, inhale, exhale, rise, legs straight. Keep the trunk in balance and hold the posture. Slowly descend, chain. Left hand across, right hand on the back, inhale, exhale, rise, the trunk up, straighten the legs, feel the posture, feel the muscles of the back, feel your abdominal region. Slowly descend. Relax your arms. Chair has a lot of advantage in giving you support. You can also change the height at which one rests the legs. That also has added advantage. Put the blanket on the seat of the chair. Now we are going to increase the height of the support for the feet. Sit in the cross-legged posture. Inhale, exhale, turn to your right side, left hand on right knee, right hand fingertips on the floor. This is a gentle twist to ensure that the lower back, in case there is any stiffness, gets relieved. Slowly come up and change side. Inhale, exhale, turn. Chest and navel up. Breathe well. As we inhale, abdominal cavity should expand, and as we exhale, it should contract. Slowly come up. We shall repeat the downward facing bridge. Lie on your chest. You can flex the knee, rest the toes on the seat of the chair, rest the elbows on the blanket. Forearms pressed, inhale, exhale, rise the hips, straighten the legs. Watch your breathing, watch your abdominal muscles, watch your lower back. Note the increase in the height. Slowly descend. The moment you increase the height, there is the loading on your upper extremities. That is at the scapular area that changes. Have complete postural awareness. Slowly descend down. Varying the heights and reducing one of the supports also helps to improve the neuromuscular coordination. One more time, press the elbows on the blanket. Inhale, exhale, straighten the legs, raise the hips up. Both legs straight. Watch your breathing. Rise your right leg up. So we have reduced one of the supports. Right leg down. Chain, left leg up. But even when you raise the leg up, ensure that you do not change the position of the trunk, left leg down. Both legs straight. Slowly descend. Inhale, exhale, rise. Elbows on the blanket, both legs straight. Rise your right leg up. Feel the posture. Right leg down. Chain, left leg up. Left leg down. Then slowly descend. Just relax the legs, relax your arms. Now we shall try with one hand support. Press the elbow and forearm on the blanket. Inhale, exhale, rise, taking the left hand up on the back, legs straight. Slowly descend down, chain. Press the left forearm, take the right hand up, inhale, exhale, rise the trunk, legs straight. The shoulder girdle and hip girdle should be parallel. Do not tilt them. Relax your legs. Watch your back muscles. Press the elbow and forearm on the blanket. Inhale, exhale, rise, taking the left hand up on the back, legs straight. Slowly descend down, chain. Press the left forearm, Take the right hand up, inhale, exhale, rise the trunk, legs straight. The shoulder girdle and hip girdle should be parallel. Do not tilt them. Relax your legs. Watch your back muscles. Press the palms, slowly get up. Sit upright. Now keep the blanket on the top rib of the chair. We are going to further increase the height. Before that, gentle twisting one more time. Sit upright in the cross-legged posture. Inhale, exhale, turn. Left hand on right knee, right hand fingertips on the floor, turn. Most of these stability postures do tighten up the abdominal and the back muscles. Slowly come up, change, inhale, exhale, turn. So having some gentle twisting in between is definitely useful. Do not hold the breath. Have complete postural awareness. Slowly come up. Line your chest, feet resting on the seat of the chair. Adjust the distance properly because now you will have to rest both the feet on the top rib of the chair. So, when you increase the height, you can note the variation in pressure on the upper extremities. Rest both the elbows on the mat. Rise your right leg up, rest it on the top of this chair. Then left leg also up, both legs straight. Legs and trunk in line. Look at the tilt. The gradient increases. Now breathe well. As the gradient increases, you can see because of gravity, the force situations of the abdominal cavity at the upper arms, they change. You should observe that. As you exhale, contract the abdominal muscles. All the pelvic organs and abdominal muscles slowly move towards the chest. Flex the knee, gently land. Very important. By landing, don't try to crash the knee. You have to flex the legs gently, take the knee one after the other and relax. Press the elbows, both the feet on the seat of the chair. Inhale, exhale, rise, take the right leg up and then the left leg, both legs straight. Keep the neck relaxed, but in line with the trunk and the legs. Now I can see the pelvic organs, abdominal organs, by virtue of the gradient and because of gravity, they move slightly away from the base. So watch and breathe well. Stabilize. Have complete postural awareness. slowly bring the right leg down, then the left leg, then relax. Be careful while keeping the knee down. Now we will look at taking off one of the supports. This would further challenge our ability to stabilize. Rest the elbows on the blanket. Inhale, exhale, raise. Take your right leg up, then the left leg. Stabilize the posture. Watch both the elbows. Exhale, rise your right leg up. Right leg down. Then left leg up. Then raise the leg. Ensure that the hips do not tilt. Watch the pressure on the arms. Left leg down. Breathe well. Slowly bring the right leg down, then the left leg slowly descend. And relax. Relax the arms also. Press the elbows, then move up. Right leg up, then the left leg. As you exhale, contract the abdominal muscles. Both legs straight. Now right leg up. Right leg down. Chain, left leg up. Watch the upper extremities. Watch the lower back. Left leg down. Bring the legs one after the other, slowly and gently. Relax. Relax the arms also. The spinal column, to be healthy, has to be flexible, strong and stable. And these downward bridges help the spinal column to become more stable and more stronger. Now we shall reduce one of the supports at the front. Instead of two arms, one arm. Press the right arm across, press the left palm, take both legs up and then take out the left hand up. Both legs straight. But ensure that the scapulae and the hips, they are even. Bring the left hand down, press the palm, then flex the legs one after the other, slowly descend. Chain. Keep the left hand across. Press the right palm, inhale, exhale, right. Take the leg up one after the other. Then take the right palm up and rest it on the lower back. Both legs straight. Right hand down. Slowly flex the knee, come down. And relax your arms and legs. One more time, right hand across, left hand on the floor, take the legs on top one after the other and rise your left arm up. Watch your breathing, watch your posture. Bring left palm down, then the legs also down one after the other. Just be relaxed. So these are all stability postures. Back, and in all these things we ensure that the integrity of the spinal column is well maintained. Press the palm, rise up, then take out the right hand. In all these, the spinal column is maintained neutrally. Right hand down, flex the knee, descend down. That is, the spinal column does not undergo any of the major movements like backward bend or front or sideward bending. All the segments of the spinal column are maintained evenly. Press the palms, slowly get up. When you do so, all these muscles, they try to get triggered in an attempt to make the posture stable. Sit upright, hips on the blanket, legs crossed. Inhale, exhale, twist the trunk, turn to your right side. This would help to relieve any stiffness in the lower back and also the abdominal region. A gentle twist, but breathe well. Slowly come up, change. Right hand on left knee, left hand fingertips on the floor, turn. Slowly come up. Pull the chair a little closer. Lie on your back. Keep a folded blanket below the neck. Spread the legs on the chair. This is a very useful relaxation for the complete back muscles. Watch your back muscles. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Because of the position of the legs, the pelvis tilts and the complete lumbar region, the lower back, can rest on the floor. As you inhale, abdominal cavity expands. As you exhale, it contracts. Also watch the posterior skin that is resting on the floor, that also responds to breathing, if you carefully observe. legs also greatly relax. We have worked on the strength and stability of the back muscles, and this posture helps to greatly relax the paraspinal muscles, also helps to relax the breathing. As a consequence of this, the mind also relaxes. And the back muscles get into good action in all this downward facing bridge, and especially with the challenge of removing one of the supports, the neuromuscular control gets a bigger boost. Slowly get up, sit upright on the chair, but don't lean onto the backrest of the chair. Keep the foot parallel to one another, press the foot, chest and navel up, rest both the wrists on the thigh, tip of the thumb and index finger in contact, palm facing upwards, eyes gently closed, relax your tongue, nose, throat and the jaws, and simply watch your breathing. As you inhale, the abdominal cavity should expand, as you exhale, it should contract. That's the first thing. Keep the chest neutral, stable. As we inhale, the abdominal cavity should expand gently, smoothly and all around. And as we exhale, it should contract. Now we are going to do the following. As we inhale, the bottommost portion of the abdominal cavity, then the middle, then the top, then the bottom of the chest, middle of the chest, top of the chest should expand. And simply relax. Abdominal region and the chest, they contract and air comes out on its own. Just watch that. You are going to do the complete breath. As we inhale, the bottom of the abdomen, middle, top, then the bottom of the chest, middle of the chest, top of the chest should expand. Feel the movement of the ribs, feel the movement of the diaphragm, feel the expansion of the lungs. Then simply relax, chest contracts, then the abdominal region contracts, air comes out on its own. Complete breath. That inhalation should be slower and steady. Exhalation should become slower than the inhalation. You must learn to exhale longer than you inhale. Just watch, but don't force yourself. It must be done very naturally, but do it with awareness. Be stable. Just watch how the air is going in, how it is coming out, whether both the nostrils are evenly active, which nostril is dominant, which is not. You are doing complete inhalation, complete exhalation, where abdomen, pelvis and chest, all the cavities are being used. The abdominal cavity and chest cavity not only expands anteriorly but also sideways and posteriorly. So all round expansion as we inhale, contraction as we exhale, you must be able to observe. Keep the shoulders even. Get involved with the breathing. Be present. Develop that awareness to be with the breath. Do not allow the mind to go to the past or future. Any thoughts? Just neglect. Increase your awareness towards the incoming and the outgoing air. Breathe with total awareness. A mindful breathing will allow your thoughts to reduce and gradually they cease. For that you should increase the presence of the mind. You must increase your focus on to the breathing, getting completely absorbed with the breath. That will help to calm the mind. And calm mind also helps the muscles to relax. Many a times the muscles get into problem because of a disturbed mind, and in this session we have worked on improving the stability and strength of the muscles of the trunk, especially the lower back. Now with a good breathing, we should reinforce the presence of mind. Thus making the relaxation to sit in much more deeper. So you have to meditate on the breath. By this approach to practice, both the body and the mind gets greatly benefited. Namaste.